Welcome everyone. I'm Sarah Muirhead and I'm here with Dr. David Chapman of Stateline Veterinary Services in Darien, Wisconsin. Welcome.
Thank you very much.
Tell us a little bit about Stateline.
We are an 8-doctor mixed animal, mostly food animal practice. We look after dairy cattle, beef cattle, swine, goats, and sheep.
What's your background?
I grew up actually in a little town, not on a livestock farm at all, but kind of fell in love with dairy cattle and like to do a lot of work with swine as well. And I really love interacting with my clients and seeing them on a daily basis.
And you're an Iowa State grad?
Correct. I graduated from Iowa State University in 2003. Go Cyclones.
Go Cyclones. There you go. And we're going to talk metritis in dairy cattle.
Correct.
So you, what do you see out there? What's going on? What's the incidence of metritis? What should producers be aware of?
It depends on the farm. Sometimes I don't see it on a lot of farms. Sometimes it happens to occur on more farms than normal. Usually it's probably in the 5 to 10% range, sometimes even more than that. I like to see as few of it, as little of it as possible, but it does seem to pop up from time to time. Producers usually seem to tackle it pretty well, but sometimes they'll have me intervene and stuff, and we're always talking about that topic and making sure we're suppressing it as much as possible.
What about symptoms? Are there certain things that kind of are a good sign to show that, hey, I might have an issue here and I need to take care of this?
Usually we'll start to see it between 3 to 10 days in milk. Some cows will actually go off feed, so it's a good thing to always be watching your fresh cows very attentively for going off feed, low milk production as well, and then be checking those fresh cows every day for a fever. Starting to get a temperature anything over 103. We need to start trying to figure out what's making that temperature go up, and a lot of times it can be metritis, and we're starting to get maybe a foul discharge from the rear end area. Sometimes a discharge in the tail is a pretty good indicator too, and odor, of course. And put that together with any of the other symptoms that she has, and we'll probably have a good case of metritis.
So would it be like per cow, or it would be a whole herd?
Usually we're looking at that incidence as just a per cow.
Okay.
We ended up talking about at the end of the year and seeing what the incidence really was for us, but this metritis is always just an individual cow side kind of a disease that we really need to be paying attention to.
What does it mean for the bottom line? What's the cost if you do not keep it under control?
Cost can range anywhere from $250 to $350 per incidence, and usually that has to do with low milk production and then getting a poor start, and then of course that's just going to be costing the producer down the line, and sometimes that can roll into other problems such as a LDA.
What about treatment? What's an effective treatment? What do you recommend?
When all those clinical signs are present and she is having a fever, I like to go ahead with a approved antibiotic and going by the approved route, and a good one out there now that's helping the producers as a very cost-effective means is Cefenil.
What would be the advantage of Cefenil over other antibiotics?
The bacteria that are found commonly in metritis are very susceptible to the ceftiofur product in Cefenil. Also, the ease of use and administration of Cefenil, it's a once-a-day administration. It can be given subcutaneous or intramuscularly. It doesn't not have a milk withhold, so cows can still be milked as normal and not have to be separated from the herd for this. And also, it only has a 3-day slaughter hold on it, so that it helps to possibly make better management decisions over other products.
Which is a little less than other products, right?
That's correct. Yes, it's probably the shortest one that's currently on the market right now for the treatment of metritis.
So for producers, that's a big advantage, that extra day, would you say?
It can be. Sometimes if we need to market cattle early, we don't like to have to do that, but if we have to, we're actually given that better option that we can.
What's the treatment protocol? Is it multiple treatments? Is it a single treatment?
It is multiple days, up to 5 days, using either an intramuscular or subcutaneous route, using beef approved practices up in the injections made in the neck, and just gone once a day.
So for 5 days, once a day?
Correct.
Do you monitor the cow during those 5 days then?
Yes.
Or look for anything in particular during that time?
Yep. I always go with attitude and appetite. If she keeps eating well and she starts losing the fever and our appetite keeps increasing, milk production keeps increasing, that we know we're winning, but I still want my producers to go that full 5 days with the treatment.
And you were one of the first veterinarians to use Cefanel, correct?
Correct. We were, I think, the first ones in the United States to have the product given to us.
And then you went out and tested it. And
Correct. And we're happy with the results. My producers are happy with the results. I've even had one say that it's like almost getting a free bottle every time I buy 3.
because of the results.
Because of the results and because of the cost, yes.
Okay, gotcha. So you started using it when? How long ago?
We just got it in May of this year.
May, okay.
And it actually came out in a good time because a lot of my producers were having to cut back on cows and then, of course, milk production because of certain quotas that they had to meet. So this was a great product to come in at just the right time to help give my producers a little bit of an advantage.
Very good. So they should go to their local veterinarian.
Correct.
If they want more information
Correct.
on this product. I'm sure that the manufacturer, Norbrook, also has information.
Yes, it's a prescription product, so it has to be gone through your veterinarian to have a good VCPR in place and have your veterinarian train you on the product if needed, but I think they'll be happy with the results.
Very good. Well, thank you so much for the information.
You're welcome.